Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review for you the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the June 2012 print journal, along with the accompanying editorials. This month's Editor's Choice is a commentary entitled "The Limits of Acceptable Biological Variation in Elite Athletes. Should sex ambiguity be treated differently from other advantageous genetic traits?" This commentary was written by Dr. Michael Bostwick and Dr. Michael Joyner, both from Mayo Clinic in Rochester, Minnesota. Dr. Bostwick is also one of our editorial board members. In July and August of this year, the Summer Olympic Games will be held in London, England, and many elite athletes will be competing. On this background, the authors discuss disorders of sexual differentiation that can give female competitors a masculine edge. As an example, the authors describe the controversy surrounding a South African runner. A medical workup ordered by the International Association of Athletics Federation confirmed this runner to have a disorder of sexual differentiation, but judged her to be a woman for the purpose of sports competition. The authors discuss the broader context of the social constructs of core gender identity and gender presentation, and the more objective and scientific definitions of sex. In the end, the authors ask us to consider that many other potentially advantageous genetic variants that are readily visible, such as long arms or a very wiry physique, can distinguish the appearance of world-class athletes, and whether it is meaningful to restrict genetic surveillance in competitive sports to ambiguous-appearing women. A video interview with Dr. Bostwick can be viewed on the homepage of Mayo Clinic Proceedings. The original article, entitled "Use of Non-Clonal Serum Immunoglobulin-Free Light Chains to Predict Overall Survival in the General Population," was written by Dr. Angela Dispenzieri and colleagues from Mayo Clinic in Rochester, Minnesota, and the University of Birmingham in Birmingham, England. In almost 16,000 residents of Olmsted County, Minnesota, who were 50 years or older and had no known monoclonal disorder, the authors tested the hypothesis that non-clonal elevation of serum-free light chains is a significant predictor of overall survival in the general population. They obtained baseline information between 1995 and 2003 and followed up status and established cause of death in mid-2009. The authors found that a high level of free light chains predicted the risk of over 4,000 deaths that occurred during follow-up. The risk ratio for patients in the highest decile of free light chains was 4.4, and the predictive value was independent of age, sex, and renal insufficiency. Of note, the increased mortality was not restricted to any particular cause of death. The accompanying editorial, "Using Single Protein Biomarkers to Predict Health and Disease in Diverse Patient Populations: A New Role for Assessment of Free Immunoglobulin Light Chains," was written by Dr. Mark Drazen from the University of Birmingham in Edgbaston, England. He discusses the role of Bence-Jones proteinuria as a biomarker for myeloma in the 19th and 20th centuries, the nature of free immunoglobulin light chains, their laboratory detection in urine and serum, and their use as a biomarker in the 21st century. He speculates on why elevated free light chains are associated with increased mortality and outlines directions for future research into their role as a predictive marker. The original article, entitled "Cardiac Channel Molecular Autopsy: Insights from 173 Consecutive Cases of Autopsy-Negative Sudden Unexplained Death Referred for Postmortem Genetic Testing," was authored by Dr. David Tester and colleagues at Mayo Clinic in Rochester, Minnesota. The authors performed analyses of the genes associated with susceptibility to the long QT syndrome and to catecholaminergic polymorphic ventricular tachycardia. In 45 of these autopsy-negative sudden unexplained death cases, putative pathogenic mutations were identified. They were more common in females than in males. Among deaths induced by exercise, the mutations were more common among the younger group, whereas among deaths that occurred during a period of sleep, the mutations were more common in the older group. The authors explain how their study provides insights into the expected yields of postmortem genetic testing after sudden unexplained deaths, and how such research can assist in selecting cases with the greatest potential for mutation discovery and directing future prospective genetic testing effort. The original article entitled "The Relationship of the Intensity of Post-Treatment Prostate-Specific Antigen Surveillance and Prostate Outcomes, Results from a Population-Based Cohort" was authored by Dr. Mohammed Nabhan and colleagues from Mayo Clinic in Rochester, Minnesota. In 832 men diagnosed with and treated for non-metastatic prostate cancer between 1995 and 2006, the authors examined whether the number of PSA tests during the first 2 years after treatment was associated with earlier detection of biochemical recurrence, prostate-related cancer mortality, and all-cause mortality. The Gleason score was the only clinical pathological variable that predicted the frequency of subsequent PSA testing. After adjustment for other covariates, the frequency of PSA testing during the first 2 years after radical prostatectomy did not increase the ability to detect biochemical recurrence or all-cause mortality. The authors conclude that evidence-based guidelines for PSA surveillance after primary treatment are needed. The review entitled "Complications Associated with Use of Levamisole-Contaminated Cocaine, an Emerging Public Health Challenge" was written by Dr. Kachiu Lee and colleagues from Northwestern University in Chicago, Illinois, and several other national healthcare institutions. The authors comprehensively reviewed the medical literature between 1940 and 2011 to allow our readers insight into the more common clinical manifestations of levamisole contamination. They discuss levamisole as an immunomodulatory agent that was withdrawn from the US market and is now approved as an anti-helminthic agent in veterinary medicine only. They describe the appearance and treatment of potential complications related to exposure to levamisole, such as agranulocytosis, vasculitis, and skin necrosis. The review entitled "Positron Emission Tomographic Scans in Lymphoma, Convention and Controversy" was authored by Dr. Stephen Ansell and Dr. James Armitage from Mayo Clinic in Rochester, Minnesota, and the University of Nebraska Medical Center in Omaha, Nebraska. The authors performed a literature search from 1999 to 2011 to address the challenges and controversies in the use of PET-CT scans in the management of patients with lymphoma. They emphasize that sensitive and specific imaging for accurate initial staging and evaluation of response to therapy in patients with lymphoma is essential for their optimal management, but that the established clinical benefit is currently restricted to the post-treatment evaluation of Hodgkin lymphoma, diffuse large B-cell lymphoma, and follicular lymphoma. The impact of PET-CT in other histologic subtypes and clinical situations is yet to be demonstrated. Finally, readers who engage in the teaching exercise provided by the article entitled "Evaluating the Patient with Diarrhea, a Case-Based Approach" by Dr. Seth Sweetser from Mayo Clinic in Rochester, and who complete the appropriate documentation, can receive up to 1 hour of continuous medical education credit. Again, please be reminded that authors or co-authors of 3 of the articles we have discussed have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.com. mayo.org in the upper right-hand corner. There, you will find additional video interviews on articles entitled Effectiveness of Patient-Collected Swabs for Influenza Testing, Statins and Heart Failure, the Paradox Between Large Randomized Clinical Trials and Real Life, and Potential Adverse Cardiovascular Effects from Excessive Endurance Exercise. Again, the author videos on our website are now hosted on YouTube and will play noticeably faster for you than they did previously. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Chip LaVie from Ochsner Medical Clinic in New Orleans, Louisiana, who has been on the editorial board for many years and was recently named Associate Editor. For previous features from the editorial team, please check the archive of the Meet the Mayo Clinic Proceedings Editorial Board and Staff feature. On our homepage, you will also find additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the June 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. Once again, please share with us any suggestions you might have for improving the quality of our print journal and website, and of our services. The Mayo Clinic Proceedings website will be updated with the July issue on July 7, 2012. Please check back on that date to hear the multimedia summary of highlights from that issue.